Hi, guys. I'm hoping I might be able to get both of your opinions on this, just as people who've been intimately involved in this for the last 20 months. Basically, what is up with Interior Health? Why is it that their unvaccinated healthcare numbers are so much higher than other regions with much higher populations? Have either of you spoken to people in the Interior about why there seems to be more hesitation with healthcare workers there? And is anything being done to try to stop misinformation that might be driving this?
Oh, absolutely. I mean, this is something obviously that I've been very concerned about, not just for healthcare workers, but many of the communities in the interior and in the north. And yes, I've had ongoing work with my colleagues in public health, both in the north and the interior, many communities where immunization rates, we've talked about this all along, where there's pockets of communities and places in communities where vaccination rates are just too low. And this virus is spreading rapidly in those communities and is causing serious illness in unvaccinated, even younger people. And that's what's putting the strain on our hospital system in the interior, in the north, and spilling over into other parts of the province, as we know. So, yes, we've spent a lot of time talking with community leaders, with faith leaders, with public health leaders. Also, I think that the healthcare workers reflect the communities that they work in, and we're seeing that in the numbers and the percentages, both in the north and the interior. As we have moved through this last couple of weeks, starting with long-term care and now acute care, we're doing a lot of work, reaching out one-on-one to each individual healthcare worker to try and answer their questions, understand what is the issue for different healthcare workers, and it varies. It varies by each individual's understanding the questions that they have, and some people are quite dogmatically against vaccination, which is unfortunate. But I think we are doing everything we can, and we're happy to take any other suggestions that people have. But this is important, and I think there was a sense of, are we going to follow through with this? And I hear overwhelmingly from my colleagues that they are supportive of this, how important it is for us as healthcare workers so that we can show up, even if it only causes a mild illness. It can have a tremendous impact if a healthcare worker gets sick. Plus, we can expose our colleagues, which we also know has impacts both in acute care and long-term care and in the community. And of course, most importantly, we can expose those people that we care for. So it is important. It is something that we are individually addressing with each healthcare worker who's been affected. And we've seen a steady increase in people being protected.
And of course, Lisa, I'd say with respect to interior health, just looking at the numbers, and we'll be sharing these, is 95% of healthcare workers in interior health have got a COVID-19 vaccination. 95%, that's 19 out of every 20. It's just that the differences, these differences at the margins between health authorities mean a lot when we're supporting health systems in these regions, in the regions. So 95%, the vast majority of people, I think it's in the mid 80% now, got their dose 1 immunization against COVID-19 in the Interior Health Authority. And we've seen the actions that many interior communities have taken from Kelowna to Kamloops to Castlegar to Cranbrook to other communities throughout the Interior Health Authority they've taken in recent times. So we have gone since we put since Dr. Henry and Dr. Pollock put the Interior Health orders in place. We have reduced our test positivity from in the region, or Interior Health has, from 14 to 15% in that range when the orders came in, to 5 to 6% today. So progress is being made, and the level of vaccination is very high. It's just relative to other communities. It needs to be higher, and so the impact on healthcare when you have 1,018 workers, albeit out of 20,430 not vaccinated is significant, and we have to make adjustments for that, and we're making those adjustments, and the teams at Interior Health are doing that. I would say as well, again, that this represents people who have worked at least one day every 3 months. So I think Interior Health in many communities has done just an exceptional job overall, not just the health authority, but people living in Interior Health. And we see there in the healthcare system a slightly higher rate of people who are unvaccinated. Obviously, vaccination rates are considerably higher in Interior Health than they are in the North, and we see the impact on the North in the patient transfers, the 90-plus patient transfers we've seen in the last little while. So we just have to continue to work hard, I think. But the massive majority, 17 out of 20 people over the age of 12, 19 out of 20 healthcare workers are vaccinated in Interior Health. And so we just got to keep pushing to raise those numbers, because the difference between 85% and 90%, when you look at it on the flip side, is the difference between 10% and 15%. And one is considerably higher than the other when COVID-19 is ripping through unvaccinated populations in our province and causing considerably harm, with the worst health outcomes going to those who are unvaccinated by a wide margin.